Right. Good afternoon. And yes, I'm here myself. Dr. Yaffe is on another federal, provincial, territorial meeting. Lots of discussions on gatherings, numbers, and different aspects in there, as many provinces across the country are moving to new levels of recovery and are easing off on some of the public health measures in a very cautious and I would say monitored way, incrementally. And we're trying to compare notes and see how we're doing in that regard. So before I get into the comments on our direction here, because there's a lot of announcements you've heard in the last 2 days, especially midnight tonight, with moving to stage 2, and I'm going to be talking about that after we look at the numbers here, because part of that is predicated on where are we at as a province and how are we doing. And in that sense, there's a lot of really good indicators that as we have continued to be stalwart in our activities to minimize contact and to take precautions, we're seeing a number of good indicators across the board on what that means. For example, the number of new cases today is, for the total, is 203. So that's the lowest we've had in a long time. And as you remember in the past, I've been wanting to get us down to around that 200 range, because that's where we were when we started to lose some of our community spread, and now we're back in there, and the health units in general are feeling much more confident in their ability to do the assertive case investigation and case contact management. So with that, you can still see that the new cases mostly are in Toronto, under 100, which is also good to see. And Peel with 44, York Region and 13, but some of the other ones like Windsor, Essex, and with 13, and Holman, Norfolk with 11, up a little bit from their other numbers and down a bit. So one of the things we're going to be emphasizing is we're not looking at the daily, because they go off and on. We're trying to look at the weekly trends. I'm going to comment on that in a moment. We have a lot of people recovering still in that, and with there, so we have right now 25,885 people recovered, and that means out of the total, because then we only added 200 in, we had another 505 who recovered. So we have more people recovering than becoming positive on our daily results, and as a result, our number of active cases left, the ones that are still in their 14-day period, is out of the whole province is 3,172. So these are very good indicators of where we're going in that regard. So, and the number of people in the hospital continues to decrease. Cases being seen or admitted is down by 42. The number of people in ICU has remained stable as people take a while to work through on recovery in that. And ICU has pretty well remained the same. ICU was 120 and ventilator was 87. Unfortunately, we're still having deaths, but even the number of deaths in the last few days have gone down considerably, what we've seen even in the week or 2 weeks before, with 12 deaths reported today in our numbers. So again, another good metric. If we're looking at our weekly numbers, and this is what we're going to try and go to and look at how we're doing week by week, because there are fluctuations in each day, and we're seeing over time less severe cases presenting. We're seeing a differentiation in the demographics of the people coming forward being tested and positive. Of course, our numbers in the over 80 and the over 60 are dropping off, while more people, of course, the same or more people in the younger age groups are coming forward, and that means they're making up a larger percentage of the positive cases. But we're dealing with a smaller number overall in the with 203, as I noted before. Also, we're seeing our outbreaks are changing from being long-term care, which is decreasing, down to 68 at this time. So it's a new low with the numbers continue dropping off. And I'll comment a bit in a moment what the Premier had announced and the Minister of Long-Term Care had announced earlier today in that regard. And we're seeing more related outbreaks in like farm settings, as we've talked about in the with the migrant farm worker areas, but more in other industries and companies. And we're seeing that as how public health is undertaking their investigation and identifying not only the cases, but actually a number of cases in some of those settings and declaring outbreaks and taking steps accordingly to limit any further spread in that regard. So also I'm noticing that we used to have this asked many times, the 15% difference between males and females. We had suggested that was due to the population in our long-term care facilities, and now we're not doing that testing. We find that now the males are starting to surpass the females in the last week of the ones getting tested. So in fact, that differentiation has been reduced down to pretty well equal in that regard, and it depends on the population that you're sampling. So that's another trend we're seeing. And of course, less of their cases are in the over 60, as more and more of the younger people are making up the smaller, or the percent of the smaller numbers becoming positive. So just some ideas of how the weekly numbers are going to trend and how we use that to look at our regions that you heard about, and I'll comment on that in a moment. So this last week, we had 2,291 cases reported. Even in the previous week, we had 2,627. So quite a drop within the 2 week, one week to the other, and we're seeing that dropping off as we go forward and ahead of time. And again, the highest number we're seeing on a percent basis is in the 20 to 40-year-olds, as someone asked, but the actual number of 20 to 40-year-olds that were positive was actually down this last week period compared to the week before, but pretty close the same. So we're trying to watch that at the same time. Furthermore, 36% of the cases still have no EpiLink identified, and that's a concern because we want people to be aware of who were your contacts if you're positive. And that's going to be a challenge, and I'm going to be asking or talking about that on a go-forward basis, because the success of our case contact management is that you have to know who your contacts were. And that's not just because it's to blame someone, but to go and approach them, and they did not know they were positive, and they need to be addressed, and other ones as well, including some are vulnerable within that group, and how to handle that. And I said our institutions are dropping off. On the testing side, especially is interesting to see, is that today we reached a new record high of 24,341 tests were performed, and the positivity rate stayed low at, it was 1.5 yesterday, 1.6 today, pretty well the same positivity rate. And that means we now have done over 924,680 tests, heading towards the 1 million mark in that regard. So that's excellent, and there's a lot of tests pending. So I expect tomorrow's number will be somewhere close to this, and we'll see how that continues as we're now starting to go into some other testing sites with our strategy group doing some testing in some work locations, be they some in the farm settings and some in actually companies that have entertained having their staff tested. So this will even add further to our data around asymptomatic testing in that regard. So in that light, we have announced earlier in the week the movement to stage 2 as of midnight tonight. We did announce which health units, because we divide up in the health units around the province. That's where our public health measures table does the metrics on that and looks at that. We also talk with each medical officer of health on the ones that are going to 2, the ones that are staying at 1, and the ones that are sort of on the borderline of where they would see it and where their comfort zone was with their data and with their consultations with their local boards, as well as with their municipal counselors, a number who are on their boards of health anyways. And in that light, we had picked the 10 that the metrics and data was still concerning on a number of different areas, because there's a number of things to take into consideration here. And so we listed those 10 on Monday. And just to let you know how the process works is that on this week, as we complete the week data, on Friday, we will review that with our public health measures table. And some of those ones that are in the stage 1 held back for the week would be considered to move up to stage 2, depending on how their data moves and shifts in that regard. And that decision is then discussed with the medical officers of health on the Saturday, and then that is then announced, as we did last Monday. If there's any changes in that status, would be announced on the coming Monday of those that would be entertained to go to stage 1 or 2. It is our hope, of course, that as we're undertaking this, that we would not be, hopefully not, having some go from 2 back to 1. Excuse me. And so we don't want that. And that's part of the thing. As we're undertaking this step now, it's like I compare it to like people at the starting line of a large race, like a marathon. And I've heard it said you have to be very careful at that stage. If everybody bolts out, a lot of people could trip over each other. You can get some injuries. And you want to pace it and take it carefully and watch those around you as you move out. We do not want a trip coming out the gate, if I can use that. So as we go from these 1s to 2s, there's some things happening. There's more things out in the community to avail yourself to. There's more possibilities. We're seeing from our information that more people are moving out and around. And therefore, it's even more important that you be careful with your personal protection, especially those who have concerns. That means still the 6-foot distancing. Yes, we moved it up from a public gathering of 5 to 10, but they still have to maintain the social physical distancing and wearing masks or facial cloth coverings in those areas where you feel you might be compromised and cannot always maintain that 6-foot distance. So you have to be actually even a bit more vigilant on that as you're out and around. That means sometimes having to go the extra mile, if I can use that phrase, because some people may come into maybe less adherent, and instead of making it a difficulty, just step around, as you say, step off and walk around the 6-foot distance. And if you're wearing the mask or in retail centers, you may see some things. And if there's concerns to you, you can always report it to your local authorities, your local public health, if you feel there is a center that's not adhering to what the standard should be and there's a possible risk factor. But you can avoid those if you so wish to do so. In that, you've heard the announcement today, as I've been hoping for a while now, that they felt it right at this stage to open up the visitation with some limitations and standards on there in long-term care facilities as well as other congregate settings, because there's a great need of people to have that connectivity. And again, that's in non-outbreak facilities, and they're trying it in an outdoor setting at this time. And of course, it's under the limitations of local facilities as they watch that. But those are in non-outbreak settings. And so we really have been encouraging that to occur, as many family members and friends have been wanting to undertake to have that connectivity with their loved ones. And so that's good to hear and to see in that. At the same time, we're going to be looking at, in our own aspect here, of with other talks across the country about the whole concepts of around bubbling, different names for it, combining bubbles, merging bubbles. In a sense, if you're going to go into that kind of concept, you really need to know if you're going to do that. Like in your household, you know who your members are. You don't have to wear 6-foot distance and wear masks in the family setting, but you know that, and you trust that each one is going to do what they need to do to stay free from any contact with risk factors. If we're going to entertain doing something different on that, and we hope to have some talk about that even as early as tomorrow, to look at how we can undertake to do that in an Ontario context, because we would like people to do it well, and do it consistently in that, because you have to understand that type of protection if you're going to do that in that regard. So we hope to have some information on that, the technical material. There is evidence and science behind it, and details that we would help, because we understand, and the medical office understand, that there's people out there with personal issues, some with loneliness and isolation, some with some need for help, whether it's families and children, and so we really want to make sure we provide that kind of flexibility, different than the social public gathering, which still has to maintain the 6-foot distancing, and how we might want to do that. So we hope to have something on that as we move into stage 2 midnight tonight, or tomorrow, if you may. So a lot going on, and a lot happening, and that means people have to stay focused, and to even put a bit more attention into that your personal behavior, your personal contact. You see, I have my mask here with me. I wore it on the way up, I wear it on the way back, and out there, and I'm doing it all the time because you have to walk the talk. And so I encourage you to do the same at this time, because each of these stages is not like the whole year. We're talking about a few weeks, and then we go to the next one. So pace it. Take it easy. Take one step at a time. We'll get there. We'd rather go stalwartly forward rather than jumping forward, going back, jumping forward, going back. Let's do it. You've done a great job so far. Our data shows it, and I think we can continue to do in that direction and see the numbers even improve further as we go ahead and open up the province under the direction and leadership of the Premier, and of course with other cabinet ministers, including the Minister of Health and Deputy Premier. So with that, I'm going to take questions.
Okay, we'll move to the phone lines. Just a reminder, one question, one follow-up.
Please go ahead.
Hi, Doctor. Just in regard to the outbreak down in Windsor, Essex, in the last 3 days, it's been about 70, a little over 70 new farm workers down there. What's your level of concern on that? Because those seem like pretty big jumps, and if those people are each spreading, it could get dangerous.
Yes, and one of the aspects there is the local medical officer of health had undertaken to do on his own volition a wider testing in that, and we're hoping to back that up with even some further testing on some of the farms, because there's many down there, of doing somewhere where they may have been asymptomatic. So that's something that our strategy group is saying, could we bring a mobile team down and assist you in this regard? So the local medical officer of health has been proactive in undertaking that, and as you go testing, he's finding some more. It doesn't mean they're all in one center, and then you're actually taking out steps to curtail that. Unfortunately, as you heard, there have been 2 deaths related to those farm workers in there, and so we continue to have that discussion with not only with Windsor-Essex, but with the other ones in the province, knowing that we have well over 10,000 migrant farm workers in the province, and right now our testing is somewhere around about around 420 or 30 of those have tested positive. I haven't got the exact number. So even though it's a small percentage, as you're hinting, it is one that's concerning, and we want to move on it quickly. And as the local medical officers of health are trying to do, if they have an outbreak, to take action and work in concert with the Ministry of Agriculture, Food and Rural Affairs to assure a timely, reasonable, and an effective response to avoid what you're alluding to there as further bad consequences.
Follow up?
Yeah, thank you, Doctor. Do all these health units with migrant workers from Niagara over to Windsor, Essex, do they need more help? Do they need more assistance? Do they need more programs to put up barriers in workplaces, or to space people out more with trailers and whatnot, or so they're not crowded in bunkhouses? What do they need?
Well, they have the ability to do all the tests they need to do. They're working in concert with the Ontario Ministry of Agriculture, Food and Rural Affairs. In that, there's some national guidelines as well. And as you see, when we have outbreaks, we have to move those people out of those settings, put them in separate facilities. Some are using hotels, local hotels and motels, to put them in to cover their costs for the 2 weeks during that time. There's methods to look at how to compensate the farm folks on that regard to have ongoing cooperation. So it's a full team approach in there, as each of the ministries, including Ministry of Labor and Agriculture, Food and Rural Affairs, and of course with federal counterparts, want to make sure that it's handled in a way, because these were deemed early on, both by the federal government and by the provincial counterparts, to be essential services for the food production for the citizens of Ontario as well as others throughout the country. And so any resources they need, they're being moving forward. That's why we're offering to even send down a mobile unit, which Dr. Heyer is trying to negotiate, to go and do some testing proactively at places where there has been no outbreak reported at all. And so we're putting everything we can in to curtail any further outbreaks as best we can, being sensitive to unique issues that are in each location, and adding resources as necessary.
Next question.
Your next question comes from Christina Tenalia with CP24. Please go ahead.
Hi, Dr. Williams. I'm wondering what your advice would have been to the Minister of Health about going out in public while awaiting for her test results, even though Minister Lecce had tested negative.
I've only heard a little bit. My understanding is that had heard that the Minister Lecce was negative, and that they had consulted with a medical public health type person in an appropriate area, and there are normal protocols that you would just monitor, because you haven't been in contact our minister with a positive case. You probably didn't need to be tested, but I think she wanted to be forthright and go ahead and get tested anyways. So that was that's one case. If you're actually known contact of a positive case, then you would have to do the isolation and the monitoring accordingly, as per our policies and principles.
Follow up?
So in terms of your advice, our question too is for everyone. Now that everyone is encouraged to get tested, what's your advice? What should people do while awaiting their results, which for some people could take days to get back?
So we've been, as we outlined our testing criteria at the assessment centers, one is if you have signs and symptoms, and that you're suspected of being a COVID case, when you get your testing done, you're supposed to stay in self-isolation until the results, because the assumption from the testing doctrine that you are a probable or possible case. And so you have to assume that until you get the negative result. Other criteria, you say, well, I was in contact with a known positive case. That's another reason to get tested, and you still have to self-isolate until you get that result back. Including people say, well, I'm not sure, but I was in a highly risky area, I don't know. And that was our main criteria. If you're talking about testing asymptomatic people, which we moved into, for example, if you go into an area and people are getting tested asymptomatic, say 5,000 workers, none of them have symptoms, none of them are cases. We're not going to say all 5,000 wait for 5-6 days to get the results back. They just continue going to work because it's an asymptomatic testing. They have no signs of symptoms. They have no contact with a case, no possible contact with a case in there, and there's no evidence of an outbreak. So it's a different situation altogether. So that may seem a bit confusing as you start to move into the asymptomatic testing in that regard. And so we're trying to communicate that as clearly as we can, especially for our assessment centers and our healthcare providers who are assessing these individuals and making recommendations accordingly.
Next question.
Thank you.
Your next question comes from Sean Jeffords with the Canadian Press. Please go ahead.
Good afternoon, Dr. Williams. Just wanted to follow up on the questions that Rob was asking a little bit earlier about migrant worker outbreaks, specifically in Windsor-Essex. The health unit there has decided that it is going to start proactively disclosing workplaces that have outbreaks. So that's 2 or more people who have COVID-19 or have tested positive for COVID-19 in their workplace. They say that rule is not mandatory across the province, but they're choosing to do it. I'm wondering why the province doesn't require a reporting of all COVID outbreaks in workplaces, especially given that we are now moving to stage 2.
It's a good question. We haven't required that if a health unit is undertaking an investigation in a setting that they would publicly declare it, especially if they are of the mind that they have everyone that's involved contained. And they're dealing with that. The idea of announcing it is in case you want to get other people who might have come in contact. And you want to use that as an enhanced case contact management. Announcing just for the sake of announcing, it may be useful, and we may go to some process to do so because we're doing more and more outbreak investigation, which is one of the benefits as we get the numbers lower and we're doing that case investigation. We're not only identifying and following up on the known cases, we're going to go out and find cases that are in that setting there. And that may be the case if you have a company that you're investigating and you're satisfied that's all they do and you got everybody covered and it's contained, you're okay. But if you find out there's been a lot of public interaction in that setting, and you may say, I think the public need to know that during this day and that day, in this period of time, there's been an outbreak of COVID positivity. If you had contact in that setting during that time, you need to contact public health because we are aware then there is a potential risk for the public in that regard. So that's the public health reason for making it public, because you want to engage and to look for more cases or potentially reduce any risk factors therein. We haven't said yet, we may still go that way of saying, just for the information, we may post that anyways in that regard. So we haven't made a decision on that as a public health measure. But right now we've left the medical officers of health to announce it when they feel it's necessary in the pursuit of their ongoing investigation and to make sure that their public and community, if there has been a potential risk to the community, is informed of that matter.
Follow up, and this is the last question.
Dr. Williams, this is on another matter. The province said a couple of weeks back that it was going to allow a number of regulated professions to reopen and start practicing again. Dentists and dental hygienists there is a conflict between the guidelines that their particular regulatory colleges have established when it comes to reopening and dealing with COVID specifically. And it sounds like this conflict has slowed the reopening of a lot of offices and created a great deal of anxiety, specifically among dental hygienists who feel like the rules that dentists are following perhaps are not as fulsome as the rules that they are required to follow. I'm wondering if Public Health Ontario has a role here and needs to step in to try to harmonize these guidelines and ensure that everyone in an office, in a dental office, is working under the same rules.
So we put out the general how the protection is necessary, and much like they do in the hospital setting, various other ones, that there's a wide array of services being provided by different professions in different way. We trust the hospital leadership to make decisions on who should wear one type of PPE in what setting versus another personal protective equipment in another setting, and that's based on a risk assessment in that regard, and then requiring them to do so. And that's on their knowledge of knowing what the procedures are, what are the potential aerosolizing generating medical procedures or procedures writ large, and then the need for a step up to an N95 type aspect versus a surgical or medical mask with a face guard, etc. So in the same line, we let the College of Dentistry, who handles that and gives the guidelines and directions out, who have the expertise and knowledge to put those guidelines out, knowing what the procedures are, far more, I would say, intimately than we know as from public health. We will take their direction and get some leadership on that if we have questions, and we are sending these over to them when we get people asking that from their hygienist community and asking if this has been considered, or they will change or alter that accordingly. So the colleges are there for that purpose, to regulate their members and to give recommendations. They have the expertise and the responsibility, and we're trusting them to do that with the best science and evidence and in accordance with our provincial guidelines and directions. So we'll have to trust that the college will continue to review the matter and to deal with any concerns and issues that are raised by the various members in that regard, to protect the health of the patrons coming in, as well as, most importantly, the staff who are in those locations as they undertake these services that are now available. And we're pleased that that's becoming available to the public, some who need essential critical work or more critical work at this time in their dental hygiene and health in that regard. So that's where we're going with the college at this time.
Thanks, everyone.